Okay, so picking up on SMART goals, learning outcomes in nursing education should always be set by SMART goals. I'm sure this isn't the first time you've heard it, but we'll go over it again. Um, Specific, measurable, achievable, relevant, and time bound. So, specific, state exactly what you want them to learn. What is your goal? Whether it's for a skill or a lecture or even a course or a program, whatever it is, be specific in what you want them to know. Make it measurable. How are you going to measure the fact that they learned this material? Are you going to give them an exam? Are you going to make them repeat a skill? Um, Say it back to you. How is it that you're going to know that they did this skill and or that they learned whatever it was that you specifically stated you wanted them to learn? Is it achievable? Make sure that you think of it from the frame of mind of a new learner, perhaps. Maybe this information is um, not new to us, so we forget, seems like common knowledge, but to someone who's never heard it or never done it, it might be new to them. So make sure it's achievable. Is it relevant? Um, Maybe you have this really cool thing you want to teach them, but are they going to need to know it right now in this rotation? Maybe not. So make sure it's relevant to the bigger picture and time bound. When exactly do you want them to know this by? 5 minutes, at the end of the day, at the end of the course, at the end of the program, time bound. So specific, measurable, achievable, relevant, and time bound. Okay, domains of learning. Nursing education encompasses three primary domains of learning. Oh my goodness, each representing a different aspect of professional competence. So the three domains: cognitive, that's your intellectual skills, your knowledge, your learning domain, higher level thinking, factual knowledge. The affective domain, this is our beliefs, morals, attitudes, cultural sensitivity, our innate empathy as a person. And then psychomotor is our technical skills. Can we physically do it? Clinical procedures, using technology, maybe a physical assessment. So 3 areas of domain, and we're going to go over each one. Cognitive thinking, affective feeling, beliefs, psychomotor, physical. All right, so we're looking into the cognitive domain first. We need a taxonomy. We're going to use the one specifically developed by Bloom. And it organizes the intellectual skills, because remember, cognitive domain is thinking, intellectual, according to principles of increasing complexity. It's a hierarchical system. And that way we can design learning activities and assessments based on these different levels, and progressing throughout, whether it be the day, the course, the program. We can use these Bloom's taxonomy levels to guide us in that process. So from simple to intermediate application, to complex analysis, to advanced evaluation and creation. So let's look at that. So the original Bloom's taxonomy was developed in 1956 and changed in 2001. The ideas stayed the same, but what we did, they changed it from nouns to verbs. So instead of, we actually changed it so it emphasizes active learning and action using a verb. So from evaluation, we went to create, synthesis, evaluate. You can read that. Okay. So this is the new revised Bloom taxonomy. And this is just really, really important to have on hand to remember to know. Sorry. Um, because, for example, if you think about a nursing program, first semester students, we're going to ask them to remember and understand, maybe a little bit apply. By third semester, they should be remembering, understanding, applying, and even analyzing. And by sixth semester, they should be able to go all the way up, if not through like through evaluate to create. Maybe they're not creating yet by the end of sixth semester, but they should be able to evaluate by the end of sixth semester. In general, critical thinking, right? So you need to design your course, design your instruction, and design your assessments based on where you want them to be in this taxonomy. Okay. A little problem here. Bear with me. Okay. So level one, remembering.